Hello, this is Monroe.
Hello.
Nice to see you. My name's Dr. Ahmed. I'm one of the doctors here.
Yeah.
And I'd just like to examine you if that's okay.
Yes, that's all right.
All right, so I'm just going to start by taking a look at you. Let's pop that there. Just taking a look at your scars, that's all. Thank you. I'd just like to have a look at both of your hands if that's okay, Mrs. Monroe. Okay, just want to turn your hands over, please. Thank you. Right, just going to have a feel of your pulse if that's okay. I'm going to feel that side as well. Thank you. Any pain in your shoulder? I'm just going to lift your arm up. Thank you. Just relax your arm down. Check the blood pressure at this point. I'm just going to have a look at your neck if that's okay. What I'm going to ask you to do is just turn your head ever so slightly to your left. Perfect. Thank you. Thank you. I'm just going to press on your liver, if that's okay. Just like to look at your face now, so just turn this way. Perfect. Thank you. Okay, just open your mouth for me. And put your tongue up to the roof of the mouth. Perfect. Thank you. And close your mouth again. I'm just going to have a feel of your neck, if that's okay. So feel the pulse of the neck. Just going to have a feel of your heart. Is that all right?
Mm-hmm.
Just going to slow that down a second. Okay, thank you. Just going to have a feel here. It's fine. Just going to have a listen if that's okay. Just turn your head slightly that way. Perfect. I'm going to feel the subclavian artery here rather than the carotid. Okay. Okay, what I'd like you to do, Mrs. Kane, is just pop your left hand behind your head like that for me. And just roll over slightly onto your left, actually, onto the opposite side.
Sorry.
Is that right? Perfect. Just going to feel your pulse. Breathe in, breathe out, and hold it. That's fine, thank you. And if you can come back now, you can pop your arm down. You can sit forward for me. So sitting right the way forward for me. Perfect. Just going to have a feel. Okay, so breathe in, breathe out, and hold it. Okay, breathe in, breathe out, and hold it. Thank you. So I'm just going to have a listen to your neck. Just breathe in, hold it, breathe normally, and again, and hold it. That's fine, thank you. All right, I'm just going to come around to the back, no scars. So deep breaths in and out, please. That's fine. And you can relax back again. Just going to have a look at your legs. It's not painful, is it?
No.
Thank you. I'd like to complete the examination by examining all the peripheral pulses, checking the blood pressure in both arms, assessing for any radiofemoral delay, checking the patient's observation chart, assessing her temperature, pulse and respiration, as well as dipping the urine for any blood or protein. So on examination I've found that Mrs Munro actually has a regular pulse rate of around about 90 beats per minute. I've not checked her blood pressure, but I would do that also. There is a loud metallic first heart sound in association with a pansystolic murmur heard loudest to the apex with the patient leaning in the left lateral position. The pansystolic murmur radiates to the axilla. She also has a scar in the region of the thyroid, which may be from a previous thyroidectomy. She has a median sternotomy scar. There are no scars on the legs and no evidence of any peripheral edema. Mrs Munro appeared to be comfortable, breathing at a good rate and a good colour. She had a single median sternotomy scar, but also noted was a thyroidectomy scar. Auscultation of the precordium revealed a loud pansystolic murmur heard loudest at the apex, radiating into the axilla. This was in association with a metallic S1. Clinically, the patient was in sinus rhythm with ectopics. In summary, this is a lady who has a metallic mitral valve prosthesis that is associated with a pansystolic murmur. This may well indicate mitral valve incompetence. It is less likely that she has tricuspid incompetence as there was no CV waves, and therefore the systolic murmur likely relates to incompetence of the mitral valve. Mrs Munro had a metallic first heart sound. When we listened to her chest, it was quite clear that she also had a pansystolic murmur, so it's important to give a differential diagnosis as to what this could be. This is either going to be mitral valve incompetence in association with a previous mitral valve replacement. You need to also give a differential diagnosis that this could also have been tricuspid incompetence or tricuspid regurgitation, though this is less likely as there was no evidence of any CV waves.